A very warm good morning to everyone present here. I'm Shivi Srivastava, second year resident from LLRM Medical College. And the aim of my study was to analyze the functional and visual outcome of corneal grafts after therapeutic penetrating keratoplasty in patients of fungal keratitis. There has been no conflict of interest and no financial interest to disclose during the study. So we begin with what is TPK. Therapeutic penetrating keratoplasty is a surgical procedure in which a diseased cornea is replaced by a healthy donor cornea with the main purpose to restore the structural integrity of the eye, to resolve an infectious or inflammatory keratitis which is refractory to conventional medical therapy, and to eliminate pain. Therefore, it is the surgical procedure of choice when all these indications are present, such as in case of a corneal ulcer that has been unresponsive to medical therapy or has perforated. Mine was a hospital-based surgical interventional prospective study conducted in the upgraded Department of Ophthalmology of LLRM Medical College. OPD patients who had non-healing fungal corneal ulcer underwent detailed ophthalmic examination, and 20 eyes were selected for therapeutic corneal transplant after obtaining an informed consent. All glycerine-preserved grafts were used. Patients of all ages and either sex who were not responding to antifungal treatment for 2 to 4 weeks, or the patients who had corneal perforation or impending perforation following fungal corneal ulcer were included in the study. However, patients of non-infective ulcer, patients of corneal ulcer in previously grafted cornea, patients of bacterial keratitis, fungal keratitis with endophthalmitis, patients who had poor tear film or lacrimal sac disorder, patients who denied PL or had inaccurate PR, patients who refused for the study and not willing to come for follow-up, patients with history of any retinal, macular or optic nerve pathology that may hamper the vision, and the patients of penetrating keratoplasty was done for other indications were excluded from my study. We see the following photographs of the patients who underwent surgery. These two cases had excellent post-operative visual outcome. In the first case was of 636 and in the second case was of 660 after 6 months follow-up. This patient, however, had graft failure. We see superficial vascularization due to recurrence of host pathology. In this patient, in the first case, we can see the folds on the cornea due to tight sutures. In this case, the post-op day, on the first post-op day, the visual acuity was of 0.5 meter finger count. The results of my study were that the maximum incidence was seen between the age group of 41 to 60 years, in which out of the 10 patients, 7 were male and 3 were female, followed by the age group of 21 to 40 years, in which out of the 6 eyes, 4 were male and 2 were female, followed by the age group of more than 60 years, in which out of the 4 patients, 3 were male and 1 was female. We see that 50% patients presented with non-healing ulcer, 15% patients had impending perforation, and 35% patients had perforated corneal ulcer at the time of presentation. 45% patients had pre-op visual acuity of PL positive PR accurate, whereas 55% patients had visual acuity of finger counting close to face to hand movement. Average post-op visual acuity after 6 months period was 618 to 660 in 10% cases, 3 meter finger count to 6 meter finger count in 5% cases, 1 to 3 meter finger count in 50% cases, that is in the majority of patients, hand movement to 1 meter finger count in 30% patients, and PL positive PR accurate in 1 case, that is 5% patients. So we see that 85% patients had therapeutically successful graft and 15% patients had failed graft. The reason for failure, out of these 3, 2 had immune graft rejection and 1 suffered recurrence of host pathology. Actually, host pathology recurred in 2 patients, but 1 was medically controlled and did not amount to graft failure. From our study, we conclude that corneal transplant has success unequaled by any other organ or tissue transplant. 85% patients had therapeutically successful corneal transplant, out of which 10% achieved an excellent visual acuity of better than 660. Thank you.
Okay, Dr. Shivi, why did you use glycerin preserved corneas?
Sir, because we have eye bank in our department,
Okay.
in which there is a long list of waiting patients, and
Okay.
we go to retrieve the corneas, and we need to store them for a little longer time because we need to call the patients, investigate them, and then we plan them for surgery. So for that time, because in glycerine we can preserve the graft from 30 days to 1 year. Like it is
Okay,
a
and you had
medium.
the photographs that you show. These were glycerin preserved cornea post transplant.
Yes, sir. Yes.
What's your membership number?
Ma'am, it's there in the presentation. S.
Show me the first slide.
First slide, yeah.